The end of last podcast, I was jokingly saying we're going to change this from News to Reasonable People to Take a Dump on California podcast, because it seems like something is coming out of California almost every single day where you've got policy meeting reality, and reality is winning. Today, no exception. Podcaster Newsom freezes Medi-Cal enrollment for undocumented Californians amid $16 billion budget crisis. Let's see. Got about $10 billion budget deficit as of yesterday, what we were talking about. And they've spent about $10 billion on the criminal illegal aliens insurance. $10 billion. Let's get into it. Here we go. This is a short clip, but I think it tells you everything that you need to know about podcaster Newsom's position.
Today, Governor Newsom said that the state is staring down a $12 billion budget deficit. He placed the blame on several issues, including economic uncertainty and President Trump's tariffs.
No. The spectrum, the impacts are just being felt and haven't yet fully been felt. You can point to the inflation number and say, well, it's behind us now, please. The impacts of these tariffs have yet to be felt. The impacts, however, are being felt disproportionately in the fourth largest economy in the world.
Now, the governor did not detail exactly how he's planning to cover the deficit, but he has proposed freezing enrollment in state-funded health care for more undocumented immigrants next year. The program is costing more than the state expected.
What? You literally can't make this stuff up. How much did you think it was going to cost if you just, gave health care insurance to everybody? You've got millions and millions of people coming into California because why wouldn't they? I talk a lot about the homeless industrial complex, build it and they will come. If you're giving out free health care insurance, why wouldn't you go to California? You would, but then you got to cover that expense. And when you've already got a budget deficit, you can see you got a $16 billion budget crisis here, number here, $12 billion on the video, $9.5 billion as of yesterday. I mean, who knows? It's a running number, right? It's a running number. But when you've got a hard number, which is costing the state of California about $10 billion to cover all the illegals, now we've got a situation where podcaster Newsom is basically, I got to analyze numbers. Maybe this wasn't the greatest idea in the world. Maybe we can't afford this. Yeah, what do we do? Okay, well, we can't take it away from him right now. But what we can do is we can say right now, we're going to freeze new policies moving forward, freeze enrollment for undocumented Californians moving forward. And that'll hopefully, it'll stop the absolute terrible bleeding and it'll go down to just a mild, you're not going to need to go to the hospital, but it's not looking good. You should probably get that looked at. He's trying to soften the blow, is bottom line here, soften the blow. He's doing a reverse course, as we all knew he would, because he's got to come up with it somewhere. And if he takes it from programs from legit constituents in the state of California that are able to vote and doesn't do this to the criminal illegals that have come across the border and now sit in California because they can with health insurance, then that would not be a good optic look, would it? The optics would not be good. So much of this has to do with podcaster Newsom and his 2028 presidential aspirations. Guaranteed. Hey, look what you did with the budget. You did this, and you should have done this. Facing a deepening budget crisis, Governor Gavin Newsom, podcaster Newsom, on Wednesday proposed freezing enrollment for undocumented adults in California's Medi-Cal program starting in 2026 and introducing monthly premiums for some recipients beginning in 2027. Hey, you know what? We're going to cut out the new ones, not issuing new policies. And again, we're going to bill some of the ones that we're already covering. We'll show them. A move projected to save the state's $5.4 billion by 2029. What about all that virtue signaling of everybody should have insurance? What about that? Everybody should have free coverage. What about that? You got to pay for it. This is the problem. This is the problem with virtue signaling. We love everybody, want to take care of everybody. That meets the reality of you only got so much money coming in. And with so much of the income streams not going the right direction, got to do something. This is what 𝗧𝗜𝗠𝗠𝗧𝗠𝗠𝗠𝗠 doing. Proposal marks a dramatic shift just 1 year after California became the second state to offer full-scope Medi-Cal coverage to all low-income immigrants, regardless of legal status. How many billions of dollars are Republican states saving that said, no, we can't afford to cover all of the expenses, of which medical insurance is just one? You've got housing. You've got all kinds of other stuff. You got to clothe them initially. You got to hand out whatever, all kinds of social programs. And this is on top of all the other social programs, the billions and billions and billions of dollars being spent on the third of the homeless population of the United States living in California. Under the new plan, undocumented adults who do not enroll by January 2026 will no longer be eligible for comprehensive Medi-Cal coverage. However, emergency and pregnancy-related care will remain available through federally funded programs. Children would still be allowed to enroll. If you said you were going to cover everybody, you should honor that commitment. But because it's not good optics, Podcaster Newsom's not going to do that. So what we're doing. 1.6 million undocumented immigrants covered by Medi-Cal would not lose their benefits. Still, here we go. Now, all the stuff up until the but or the still doesn't really matter. It's whatever is after that word, right? Honey, I really love you and I want to be with you forever. But I got this side piece that, still beginning in 2027, those with unsatisfactory immigration status. We got to look at that one. Unsatisfactory immigration status. What's that? They're illegals. If you want to put criminal in front of that, if they didn't come to the country legally, you can go ahead and do that. This is news for reasonable people. This is not news for liberals who are insane. A category that includes both undocumented and some legally present individuals ineligible for federal Medicaid would be required to pay a $100 monthly premium. Let's see. Came into the country, you don't have status. Maybe you can work, maybe you can't work. Who knows? But we need you to pay $100 because our budget is not looking good. It's a total about face. It's a complete about face. We took the whole virtue signaling to next level, and now we're backing off because reality is smacking on the backside. And, good Lord, these illegals are costing more than we thought. Oh, who knew? One of the articles I was reading just right before I started recording here, I just looked at the title again, and it was like, who knew that the medical coverage for the illegals would cost this much? I mean, why are you doing it in the first place? You have no obligation to do it. You have no obligation to bring these folks into the country illegally in the first place. It's against the law. And your sanctuary state, you're covering them. So this is on you. Seriously, this is on you. This is your problem. And yet, who's having to cover some of this? Federal taxpayers. Yep. Newsom's office framed the plan as a painful but necessary response to worsening economic conditions and the state's ballooning deficit, which authorities estimate to be around $16 billion. Within that video that we just watched, did you see how podcaster Newsom went from, we haven't felt the effects of the tariffs at all, but we're going to blame them anyway? What I'd like to point out is that inflation is down. And egg prices are down. I mean, what more of a win do you need than that? You got Ukraine, you got Russia, you got China, all coming to the table. Yeah. Interesting time to be a Democrat, right? Hey, what's Trump doing? He's winning. That's what he's doing. Medi-Cal program alone is grappling with a $6.2 billion shortfall exacerbated by higher than expected costs. because we had remember the Inflation Reduction Act by former President Biden, who's now in a senior care facility? Oh, he's not? He should be. Yeah, his handlers were going to put him in a wheelchair in the second term of presidency. They're going to put him in a wheelchair. That's what an upcoming book is going to say, including $2.7 billion more than anticipated to cover undocumented residents. You virtue signaled, you lost on the wrong side. It didn't go your way. And now we have to do some distorted truth telling. Blame it on Trump's tariffs. Blame it on Trump's tariffs, because we're going to take the brunt of it here in California. State must take difficult but necessary steps to ensure fiscal stability and preserve the long-term viability of Medi-Cal for all Californians, podcaster Newsom's office said in a statement. The governor's fact sheet emphasized that his team has designed the changes to protect existing coverage and maintain the state's values amid tough financial headwinds. You don't have enough money to cover all of this. You overspent. It's like a teenager who's on a budget allowance. And they're like, well, I spent it all last night. Can you give me some more for the weekend? And it's Thursday. And expecting mom and dad, the federal government, there you go. Not teaching their damn kid a thing. That's what you've got going on here. Fiscal irresponsibility, tax and spend. Democrat lawmakers, however, signaled resistance to the proposed cuts. These are folks who are working, paying taxes. Well, some of them, maybe. They should have access to health care. Everybody should have access to health care. But that's not the reality we live in. It's just not. And this was said by State Scott Wiener, the chair of the Senate Budget Committee, at a recent event. Fiscal squeeze comes as California recovers from devastating wildfires, confronting rising prescription drug costs, and braces for further losses linked to federal tariff policies. California brings in so much stuff, they're going to get killed, is what Newsom's saying. Yeah, that's down the road a ways, right? It's down the road a ways, the actual impact from that. In the meantime, he's got to come up with a song and dance for how do we pivot out of not providing healthcare coverage for all the illegals that we virtue signaled we'd love to have in our state. Difficult. Newsom has blamed former President Donald Trump's trade measures for slashing $16 billion from the state's expected revenues, contributing to the fiscal crisis. You know what you got is a whole lot of finger pointing. It's his fault. It's their fault. It's his fault. It's his fault. Instead of taking responsibility, hey, maybe you overspent on some ridiculous crap that you didn't need to. This is the same state that spent $23 billion. Some estimates are as much as $33 billion, but they kind of know where some of that 33 went. $23 billion, and they don't really have any accounting for it for the homeless industrial complex. Don't really know where it went. I'm not really sure. And you're left with, okay, but it's Trump's fault for the tariffs, right? Spin that to me. No, you can't. Compounding the issue, congressional Republicans are advancing proposals to cut Medicaid and penalize states for offering care to undocumented immigrants. I'm okay with that. States, you want to take that on as a sanctuary state? All on you. Good luck with that. Hey, you virtue signaled, you pay the cost. You pay the price. This move could cost California an additional $3.2 billion annually in federal funding. Podcaster Newsom's proposed Medi-Cal changes now enter negotiations with the Democratic-controlled legislature ahead of state's final budget deadline in June. They're just going to rubber stamp whatever Newsom does. With tough decisions looming, Assemblymember Jesse Gabriel, chairman of the Assembly Budget Committee, summed up the challenge. This is going to be a very challenging budget. Because you overspent on ridiculous stuff that you didn't need to. But, whatever. Right? I mean, I am literally doing at least one podcast a day because there's so much content coming out of California. So, and what I'm gonna leave you with is a conversation I had with my son Kieran right before I came on here. I talked with him for about an hour, and he's just kind of working his way through how all of these policies make any sense whatsoever. Not only on a national level, but presidential, like you're going to run AOC or you're going to run Gavin Newsom for president. So we're going through, all right, here's what Newsom would have to overcome. Homelessness, the wildfire response, affordability issues, gas prices, closing down refineries, and the list just goes on and on. And in talking with my son, I'm like, I don't think he can overcome all of those objections. Somebody in Montana isn't going to go, he's done such a great job with California. And it's not just podcaster Newsom. There's plenty of others further back down the line, but he's been governor for a long time. And it's not just his fault, but he hasn't really taken things in a direction. How about California's response to COVID-19, shutting everything down, but Newsom's just, eating in restaurants and going places, not wearing a mask and, rules for thee, not for me, that kind of thing. I don't think Gavin Newsom can overcome those objections by voters in Wyoming. I don't think they're going to go, yeah, he's doing a great job. Well, let's make him president of the United States. There's too many things to overcome. AOC, put her in the same basket as Jasmine Crockett out of Texas. Just let those people keep talking. Just let them talk. Don't even respond. Let them talk, and they'll do the work for us. Right? Just like Gavin Newsom's doing in California. He's doing the work for us. He's doing all the heavy lifting. Hey, let's overspend on ridiculous stuff that we don't really need, and we'll just see how it works out. Oh, God, yeah. Got to reverse course because I want to get elected president. And this isn't going right. Got to make cuts somewhere. It's going to be a tough, what was it? It's going to be a very challenging budget. I'll leave you with that. Thanks so much for being here. I'll catch up with you in the next one. Bye for now.